Good afternoon and welcome to the Leadership Checkup series hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. Thank you for joining us. My name is Casey Wu, Project Coordinator at the National Council, and I will be moderating today's webinar. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by clicking the Join with Computer Audio option in your Zoom window, or you can join by phone by dialing the number shown on your screen. Upon entering, you will be automatically muted. Please keep yourself muted for the duration of the webinar. Today's webinar is being recorded and will be archived for future viewing on both the National Council and ASTHO's website. The Leadership Checkup series is a collaboration between ASTHO and the National Council's Behavioral Health Training Institute for Public Health Officials, designed to support state, local, tribal, and territorial health officials through this unprecedented public health crisis. The goals of the Behavioral Health Training Institute are to increase the knowledge, skills, and abilities of public health practitioners and workforce to improve and enhance behavioral health strategies within public health settings. Today's presentation, titled When Your Health is Perceived as Harm, Making Sense of Public Reactions to Public Health Action, is presented by Lisa Guroff, Director of Trauma-Informed Services at the National Council for Behavioral Health. Lisa has over 25 years of experience in the behavioral health field, providing direct clinical services, clinical supervision, and administrative direction. She has worked in a range of clinical settings, from treatment foster care to outpatient mental health to a variety of residential settings for children and adults. Prior to joining the National Council, Lisa was the COO of a large mental health provider where she oversaw and directed the implementation of trauma-informed care practices across the agency. At this point, I'd like to turn it over to Michael Frazier, CEO of ASTHO, to provide opening remarks. Mike?
Thanks so much and welcome everybody to our Leadership Checkup series. I'm really excited to be working with the National Council. They have an incredible team and we're going to be learning from Lisa today, but there's a wonderful depth of knowledge at the National Council, and it's such a privilege to work with you on this really important issue. We've been hearing from health officials and their leadership teams across the country on the real toll that COVID is taking, not just on communities with infection and transmission, but also in terms of workforce resilience and morale. And we're really excited to have the chance to address this issue as we move forward in our COVID response with some practical tools that everybody can use to deal with the long-term consequences of COVID, but also some of the things that are immediate right in front of our face today. And so it's really a pleasure to be working with Lisa Guroff and her team on the topic today, when your health is perceived as harm. I know many folks are feeling frustrated and confused by why the public won't follow public health orders, maybe have questions about how to process the, in many ways, neglect of public health recommendations in some parts of the country and in some communities. And this is just the first of a series that we'll be offering over the next few months. You can visit our websites, our ASTHO.org website, and look for Leadership Checkup series to see some of the other offerings that we'll be having over this month and into the next few. They include crisis leadership and resiliency, a trauma-informed approach to COVID, avoiding COVID burnout, what we can learn from crisis, systematic racism, health disparities in COVID-19, leading through complex trauma with resilience and hope, and finally, mental health first aid, a primer for public health professionals and for communities. And we hope that you'll join us for all of these. Each event has a separate registration, and each event is free and open to any public health professional that wants to take a little bit of time thinking about themselves and how to be a better public health worker moving forward. So with that, let me turn it over to our presenter, Lisa. I'm so glad to have you in a great backdrop of Washington, D.C. there, which we understand is getting a storm today. So if you drop out, we know we have our plan B in place. And thanks so much for kicking us off with this series and checking in with us as public health leaders across the country.
Thank you, Mike. Definitely, I'm excited to be here with you guys. My heart goes out to you guys in terms of what you are, as Mike was going through, really dealing with in the throes of COVID, and just trying to keep everybody safe. So our goal for today is to be able to give you some time to relax, take a breath, take some kind of stock for yourself. And so we're actually going to start with a meditation here. I will share with you that sometimes when people screen, depending on your internet, the voice and the talking might lag. So if it's easier to just close your eyes during this, please feel free to do so. But this is really a time for you to kind of center yourself before we go into the information. So please make yourselves comfortable in terms of where you are, and enjoy.
Okay, now we're going to do something very interesting. We won't close our eyes, okay? So have what is called soft eyes, which means become aware of the space we're in. Don't focus on me, although you're aware of me on your screen, but actually I'm in your consciousness right now. But just be aware of the space we're in. And now let's start our meditation. So start to observe your breath. Start to observe your breath and don't manipulate it. And notice that even as you observe it, it slows down. Your mind will wander. When you become aware that it wanders, bring it back to your breathing. As it goes in through your nostrils and then out through your nostrils. Okay, now we're going to do something very interesting. You may keep your eyes open, but start to repeat your full name. So I am Deepak Chopra. I am Mary Jo. Repeat it mentally. And now invite all the stresses you have right now, all the things you have to do, your deadlines, all the problems you have. Invite them. Let your awareness fill up with them. Okay, now drop your last name. Just repeat your first name. I am Deepak. Mentally. And this time, invite experiences from your childhood into your awareness. When you were less than 12, your parents, your siblings, your school, your classmates, happy days, not so happy days. And now drop your first name. Just say I am, with no labels attached. I am. Let memories and thoughts fade. Just I am. Now if you want, you can replace I am with aham or om. Just a sound. No associations. Let's do it for a few seconds. Aham. Aham. Now even let that go. Sit quietly and just be aware of being aware. This is our ground state before a thought arises, before a feeling. It's who we really are, a field of infinite potential. Rest in being. Rest in awareness. Rest in existence. Just be. Okay, before we come out, feel all the sensations in your body. I hope you're feeling a little refreshed. You can do this again and do it as often as you want, and you can do it for longer. Thank you.
So thank you in joining with me in doing that exercise. It is so important that we find time to take a moment, take a pause, take care of yourselves, because we are in the midst of, as you all know, an international pandemic. We are in the middle of really complex trauma as a community, personally, and everywhere else. And so it's really important, and we'll talk about this this afternoon. It is so important that we find those moments of pause to help ourselves emotionally regulate so that we can continue with our day and hopefully at the end of this time come out of this in more of a post-traumatic growth focus than having the trauma really impact us long term. So today we're going to talk about, briefly go over what is trauma and why we're in the middle of it, talk about some trauma-informed care principles and really focus on moral safety, and then talk about when we don't have moral safety, what that leads to, which is moral injury. We're also going to then talk about making sure that you first of all take care of yourself, and then how do we, after we do that, take care of those that we lead as well. So what is trauma? Trauma is an event. It's something that, a series of events, something that we experience and has these profound individual impacts on our development and our well-being. So right now, we are all going through this collective international pandemic, but our experiences of it and our individual outcomes, the individual effects that it has are very different on a lot of us. So it's really important to recognize that although we might all go through the same event, it is up to the individual to determine what is traumatic to them. The other thing we always have to keep in mind is we can never talk about trauma without also talking about resilience. And on this slide, we have for you the different components of resilience and different areas in which we can kind of build up those strengths. Our ability to bounce back in the face of adversity. They really go hand in hand. We can't understand trauma or the impact of trauma or how we manage trauma without also understanding our resilience and protective factors. This is also a recognition that when we come from a trauma-informed perspective, we want to interact with all humans as if they've already been traumatized, having a universal expectation that the people in front of you that you're interacting with on any level have already been traumatized enough. And so we want to create an environment that recognizes that impact, but also sets up to avoid re-traumatization and really creating this new way of being. It also has a shift universally how we look at problems, situations, and people that we are interacting with. And really moving away from what's wrong with you today? What happened? You know, why are you acting this way? What did you do wrong? What's wrong with you? But really moving to the idea of asking what happened to you and what's strong with you. And that is really the paradigm shift that we take when we become a trauma-informed organization or start interacting with people in a trauma-informed way. These are SAMHSA's principles of being trauma-informed. And today we're really going to focus on this first principle of safety. And safety really applies to physical safety, emotional safety, psychological safety, and this idea of moral safety. So we want to recognize that in all these different components, there are different ways in which we can address safety and make those around us, those we interact with, and ourselves in our organizations and our communities feel safe. So whether it's physically protecting ourselves from exposure to COVID-19, psychologically addressing those fears and anxieties about taking care of ourselves and our loved ones, social safety, right? Addressing the frustration, anger, or guilt from the current social unrest, the difficulty that we have in being around those that we love as we physically distance. But then also this idea of moral safety, which is really addressing the hypocrisy between those things that are explicitly and implicitly implied. So physical safety, you guys know this. This is what you guys are working towards, right, with everybody. Really how we prevent the spread and keep ourselves and our loved ones safe. We also have those psychological safeties, really making sure that you're taking care of yourself in this time of unrest. We know that as humans, we thrive in relationship and interaction. We also know that our brain and our body function best when we are at our most calm and when we are really in like that rest and digest system within our bodies, and our cortisol levels, our adrenaline levels are lower. Unfortunately, when we are in this constant toxic stress environment and those levels raise, it can really impact our own ongoing psychological safety. So we need to make sure that we're really taking care of that and attuning to ways in which we can be more psychologically safe and emotionally safe, socially safe and connected. And then there's this idea of moral safety. So moral safety is this never-ending quest to understand how your organization functions in that healing process, both an attempt to reduce hypocrisy, implicitly and explicitly, but also we need to recognize that a morally safe environment actually struggles with, openly, those issues of honesty and integrity. It's that ability to say, I've been asked to do this at work, but it doesn't fit with my moral code to do it in this way. To be able to talk openly about those struggles is really, really important. We're also reminded during this time of crisis. These are the words of Mr. Rogers, right? When he was a boy and things were scary, his mother would always tell him, look for the helpers. You will always find people who are helping. And especially during these times of disaster, he always said he would remember his mom's words and look for the caring people, because there are really so many caring people. And all of you on the phone today, on the webinar with us, this is talking about you guys. You are the ones standing up in the middle of this international pandemic and attempting to help and support. We're reminded, right, of the Hippocratic Oath of first do no harm. I also want to recognize the AMA statement and a recognition that our current public health officials are threatened in their lives, and this is not okay. This creates an incredibly unsafe moral space. And so we have the definitions here, and I want you to recognize that moral injury is not a psychological disorder. Although we have learned a lot more about it recently in our work with service members, and we've moved in our work with service members from an idea of shell shock to PTSD to now moral injury. And what we understand is moral injury is not a psychological disorder, but a human condition and a response to really difficult issues that people are dealing with that impact where we feel like a moral failure or the impact of violence. So I have for you these two definitions. So Shea talks about moral injury as that violation of what is right by someone who is in authority, and the stakes are high. There's another definition here by Brock, where he really starts to break down the different areas of moral injury. And so what Brock says here is that moral injury is a response to trauma when a person or a group, their existing core moral foundations are unable to justify, process, or integrate the trauma in a reliable identity and meaning system that sustains relationships and human flourishing. So we need to recognize that connection that we have as humans, the context of those relationships is so important. It's whether we feel betrayed by people or institutions that should be trusted to do the right thing, whether we commit, witness, imagine, or fail to prevent an event that might be judged as harmful or evil, that violates the foundational social and ethical rules, being involved in events or contexts where violations of taboos, harm people, where it leaves us feeling dirty, like we've done something wrong. And sometimes it's also surviving conditions of degradation, oppression, and extremity. The other thing we need to recognize when we're looking at really understanding what moral injury is, it's connected to these moral emotions, these feelings of guilt, shame, embarrassment, remorse, outrage, disgust, contempt, or even revenge. And so I know it's hard to see this slide, but what it's talking about here is on the PTSD side, you have memories and intrusive thoughts. Really, when we're looking at moral injury, we might see some overlap with PTSD, but it really is this connection to these emotions in the slide. The other thing that I've been thinking a lot about is this question of when we become trauma-informed, of what has happened to you, moving away from there's something wrong with you or anything else, but really what has happened to you. And when we start to think about that, we recognize it's something happening to you. It is not something we're seeking out. It's not something that we want to happen, but something we have no control over. And so I was thinking about, for you as a public health official, what is happening to you? Are you receiving messages of worthlessness, being undermined for being scientifically correct or relevant, punished socially for speaking out, or ridiculed when your message doesn't match that people want to hear? Are your experiences being dismissed as unimportant or less than? Are you feeling like when you're trying to help people, it's being perceived as harmful? And that Hippocratic oath is being challenged. So what does do no harm do when it really morally compromises you? We also know in the news, we've seen these images over masks, over confrontations between our health officials and our citizens. We also know across the country that headlines are out there about the impact that this is having on you all. And I want you to know it's not okay. That what you're going through is an extreme situation. It is not what you signed up for. It is not part of what you intended, or any of us as caregivers intended to get involved in. So how can you take care of yourself? There are some things here on the slide. We talk about staying informed. As we talk about physical distancing, we also talk about media distancing. The news is always going to be there. The information is always going to be there. So you don't need to have it on 24/7. You can check back later. Please take those breaks for yourself. In addition to that, focusing on what we can control, staying connected to those who are important to us, and then also making sure that you're taking care of your body and your spirit. And so I'm going to actually pause here and ask Casey if you can read for me. I'm through this. If you guys can respond in the chat box, what are you doing to take care of you? How are people nourishing your soul, finding peace? Or has anyone, if you can share again in the chat box, has anyone picked up an old hobby that they weren't using before, or or haven't used for a long time, picked up something new? So Casey, can you just share with us some of the things that people are sharing in the chat box?
Sure. There's a lot of people that are taking care of their dogs, also getting out into nature and hiking some more, listening to audiobooks, disconnecting from the media, playing with grandchildren. There's a lot of grandchildren, dogs, and cats in the chat box. Taking daily walks every morning. We have some gardening, also sewing face masks to share with healthcare providers. And also exercise. There's a lot of exercise going on as well.
That's great. Thank you all for sharing. It is so important that you do these things, that you find ways to take care of you. You are the only you have. And at the other side of the pandemic, you're still going to have you. And so please make sure that you're doing things during this time just for you. We also have some slides here for you from the Anxiety and Depression Association of America. And I know that they're hard to read here. We will absolutely be sending them out, and hopefully you can read them easier there. But we have they really focus kind of in terms of managing that anxiety in 3 areas: in the mind, the body, and actions. And so here in the mind, you'll see again, accepting the things that we don't have control over, doing your best, really maintaining that positive attitude. We absolutely see people who have not experienced anxiety or stress to this level before, really also having difficulty and reaching out. So, please take care of yourself. Please make sure that you, do what you need to do, and that you find ways to deal with cope with the stress, In addition, a reminder when we take care of our body that we limit alcohol and caffeine, that we really attune to well-balanced meals. I know in the beginning of COVID-19, there were a lot of comfort foods going around Facebook recipes everyone was sharing. So it's so important that you find ways really to, in a healthy way, to manage your eating and that sleep. When I'm in the room with people, so few people, even before March and this year, were not getting enough sleep. We preach this all the time to everyone else, and I'm here to tell you, you're human like everybody else, and we please need you to make sure that you're getting enough sleep at night and doing that 8 hours. The other is exercising daily and really making sure that you're doing something. I love to see there's a lot of walking and interacting with people, being out in nature. So, so important that you find those moments again to regulate, and we'll talk about this in a minute, but just regulate your body. In addition, here are some actions you can take. What it says is, taking deep breaths. This number 10, it actually says slowly count to 10, and if you need to, do 20. I am, not just working, but I'm also a mother of 4 boys. And sometimes I find myself going to 30 or 40, right? Please make sure that you are giving time for your body to relax, right? To take those moments and those breaks that we need so that we can come back and be our best with those that we love and care for. Giving back to your community. Casey said some people were sewing masks for other providers, taking some time out, talking to people, reaching out online. So important that we're doing all of those things on a regular basis. The other thing that I want to recognize is the role of leadership during this time of crisis. And so I want to just go through some of these, in terms of championing yourself, championing self-care. So the people that you lead are going to be looking at you. And if you're not taking care of yourself, if you're not giving yourself a break, if you're not managing time and, really allowing yourself time between Zoom meetings and not getting to Zoom fatigue, then they're not going to feel like they can do it either. So it's so important as leaders that we really model that as well. In addition, we are going to send out a one-pager that will give you more information about this slide. This is actually the 4 quadrants at the National Council for our trauma-informed, resilience-oriented leadership model. And so in here, we talk about the trauma-informed care principles, adaptive leadership skills, understanding and managing the change process. And then this last one on the left is fostering supportive environments. And it's about really creating that space for people to be vulnerable and really connected. And like I said, you'll actually get an attachment with this in more detail. The other piece is regulation. So these next couple slides, or this slide, the next couple slides come from Dr. Bruce Perry. And he really helps us understand the importance of emotional regulation. So what you can see in the colors is the bottom of the triangle is your brainstem. And then it moves up to your neocortex and really more higher level thinking. The brain on the left with the bluer part in the neocortex, the more activity up in the higher functioning, is someone who's more emotionally regulated. And we can see less energy and activity going on in the brainstem. Unfortunately, on the right, we have someone who's emotionally dysregulated. And what we see here is that if you are not emotionally regulated yourself, we cannot help someone who is dysregulated, someone who's in like a bad space emotionally. Another way to look at it, these are his slides between adult and a child, but really human and human. So on the bottom, we have an adult who starts off really in that calm space. And what you can see is as they continue to stay in calm and alert, they're able, through different ways that we'll talk about in a minute, to bring that other person down emotionally, where they start an alarm, but they really end up really close to calm at the end of that. On this other slide, though, we have kind of starting in where there's the other person on the top is starting in the same place, but when the person, the adult in this case, interacting with them is dysregulated themselves, they actually lead to an explosive environment and both people escalate. And unfortunately, there's just nothing productive that comes of that. So it's important that we work through that and come to the other side. Here's another way of looking at it. This is how we discharge trauma in a healthy way. Something happens, we escalate, or emotionally we go into our sympathetic nervous system, and as we discharge that trauma, let it go, release it from our system, we move back into our parasympathetic nervous system. So parasympathetic nervous system, fight, flight, or freeze, our sympathetic nervous system. We get triggered into that trauma, and it looks like this. We go into fight, flight, or freeze. Our body floods with adrenaline, our brain floods with cortisol, everything else shuts off. If we're able to discharge the trauma, then we see our body going back to that beach, back to that rest and digest place. Unfortunately, if we're stuck in childhood or in adulthood in one of these really toxic stress environments, and we don't have time to go through that rest and digest period, that meditation that we did at the beginning here, it's so important that we do that throughout our day, because if we don't have periods of rest and we stay stuck, in that fight, flight, or freeze space all the time due to chronic stress, toxic stress, this ongoing pandemic where we're constantly in these heightened states, we can get stuck in on or off. And so for someone who defaults really to a fight in their fight, flight, or freeze, you're going to see someone stuck in that on position where they're hyperactive, they're panicked, they're hypervigilant. They might get rage very easily. But if we default more to that flight or freeze space, then we see people going into depression, disconnection. And if you're outside those two parallel lines, the black lines, then we're really at a place of where we emotionally can't handle it. And so we start to really start to exhibit some really negative behaviors for ourselves. It's not healthy. And this is what it looks like. And to avoid yourself being here at the end of the international pandemic and the traumas that we're going through, it's so important that you find periods in which you can regulate. And as if you're a leader, if you can provide those as well for your staff. Because this leads to burnout. This is where it happens. So it's so important, right, that at the end of the day, we find those breaks so that we don't lose our workforce as we come out of this. A recognition back to the resilience. We can't talk about trauma without talking about resilience, because resilience is what gets us through. And so we need to make sure we're building up on those. The other thing I want you to attune to as a leader is when we are supporting someone, making sure that we are really practicing active listening. And this is a skill. This is something that we can build in ourselves. It's in any relationship. It really conveys an investment in your relationship with the person speaking to you. And what it looks like is first listening to understand. We spend a lot of time in this country listening to respond. We have our answer before someone's even finished their first sentence. We know what they're talking about. We know the solution and we're going to provide it. Or the answer, or we're defensive because we know that they're attacking us. So if we change that perspective, if we really listen to understand first without prejudgment, paraphrase what the person said to you, and verify that what you think you heard is what they intended to say. So it looks like this. What I hear you saying is that correct? If it is there anything else you'd like to add? And if it's not correct, what did I miss? And going through that process continually until the speaker says, I'm done, I have nothing else to add. You've heard and understood everything that I have to say. But we're not done there. What it means is the next step. That once we've really heard what someone is saying and been able to paraphrase it back to them, and they've shared all of that information, then our response leans into and building the relationship. It means you only respond to what they said. And if they didn't ask you for your opinion, then you don't share it. And if they didn't ask you a question, you don't answer it. We so frequently step in with answers and with opinions that were never asked for. And it is a way to discount and push the relationship further away. So as we lean into bringing people closer together, as a leader, I want you to start practicing really active listening and just being present for what someone said. And so what that means is really we're left in a place if they have not asked us to engage in that conversation, but just to listen, is to really be more curious about what they've already shared and to dive deeper into their perspective. And what you'll find as you do that is your relationships will become deeper and more textured. We also want to empower those that we lead. So important, right, that we provide that space. You can see in the beginning here, the first one, emotional regulation techniques such as breathing exercises. Our breath is so important. You know, it takes anywhere from 5 to 10 seconds for information to come up our brain, hit that lower part of our brain, that survival response, right? Fight, flight, or freeze. Am I going to die? Do I need to respond? If we take 5 to 10 seconds and just breathe through receiving that information, the information can pass through the lower part of our brain into higher levels of thinking, and then we can actually do something productive with it. Fight, flight, or freeze is absolutely nothing productive in terms of cognition. So self-care, cognitive approaches, creating a safe, quiet, comfortable space, music, connecting with people, creating structured bedtime routines, spiritual routines, pleasurable activities. So important that you do that now so that you come out of this in a post-traumatic growth perspective as opposed to in burnout. The other thing here that I have for you is Dr. Bruce Perry's continuum here. The interesting thing for me about this perspective, and I love it, is it gives me a place to really think about where am I before I respond to anybody else, and where are they, and what's the best response. So it starts here with an internal state and the dissociative or arousal continuum, so who defaults to flight or freeze on the dissociative, or who defaults to fight on the arousal continuum. And then I want you to really pay attention as I go through and add to this chart what happens to our sense of time. And this is for any human. This isn't a special group of people over there in the corner. This is for us. So let's see what happens. So as we start in calm, we have that sense of extended future, and both of us are, our systems are in rest and digest. As our internal state starts to activate more, we go into alert. Look at all of a sudden, extended future goes to days and hours. Like we missed months and weeks, right? It's that quick that our focus changes. And we can start to see some activity on that arousal, on the arousal or dissociative continuum. But if we continue down this continuum, we see in alarm, sense of time is hours or minutes, and we might see someone either overly compliant or resistant. We then move to fear. Now someone's moment of time is, they can't comprehend something past the next few minutes or seconds. And we might see them in defiance or actually fetal rocking or extreme dissociation. And there's still another level of terror where we have no sense of time. For someone whose fight, flight, or freeze might be to freeze, they might faint. For someone in that fight area, they might become incredibly aggressive. This is not the time to try and have a rational conversation, because as you can see, they're in that fight, flight, or freeze spot. And I would argue anything from alarm, fear, or terror, the only thing another human being can be doing that's productive is helping that person regulate or calm down emotionally so that their body can relax and the information can flow up to a higher level of thinking. And when it does that, then we can have a productive conversation. But how often are we either in an alarm sense or fear sense and are trying to have a rational conversation with somebody, right? Or, they're in that place and we're saying, just calm down. Or we're talking to them about a consequence a week later that they're just not able to comprehend. So it's so important to really understand how we manage through these different levels, as all humans do, where you are at any time, and where the person that you're interacting with is. And again, like I said, I'd recommend that if any of us are past that alarm, fear, or terror stage, the only thing we can focus on that is productive is to calm and soothe our body so we can move on, right, to get back to that calm state and really have some abstract thought. So reminder that we're in that fight, flight, or freeze, there's nothing productive going on. We're really not able to respond, learn, or process. If you're driving down the road and someone cuts you off on the highway, right, and your adrenaline goes up and you're activated, if I were to ask you to balance your checkbook at that point, you'd think I was crazy. You wouldn't be able to do it. We're just not made that way. So it's so important that we find ways to access that lower brain. Through Dr. Bruce Perry's work, we know that we can activate and impact that lower brain through rhythmic, repetitive, relational, relevant, rewarding, and respectful interventions. The rhythm, our rhythm comes from our mother's heartbeat. That's why it's so engaging. That's why it helps us calm down. Rocking chairs, knitting, music, art. These are ways in which we can really start to engage with people and doing these things first and then trying to have a productive conversation later. For ourselves as well. We're all human, doing the best we can. The other thing that I have for you here before we finish up today are really some examples in which we are seeing people really struggling with moral injury and ways in which our environments are not feeling safe. So what these say is a supervisor refers to your female coworker as she's always angry about something. A supervisor says, all lives matter. What's wrong with them? A patient refuses to work with a staff because of their race. A supervisor, in reference to a client of color, says, they're like that, what can you do? Your workplace leadership is all Caucasian men and women who decide that a diversity, equity, and inclusion committee isn't really an issue for their organization because they don't see color. A patient tests positive for COVID-19, but still goes to work because of fear that they won't be able to provide for their family. And so what I'd like to do in this last period of time is really open up the floor for those of you who are joining with us, and to open up questions for Mike or myself, in which we can start to really help support you in the incredibly important work that you guys are doing on the ground level. And thank you for joining us today. So the easiest way to do questions would be to put into the question and answer section. Casey can pull those out easier than if they are in the chat box. But Casey, I don't know if some questions have come up, but also Mike, I will open it up to you if there was anything that you wanted to share with everybody.
Sure, thanks, Lisa. That was just great. I saw a lot of good feedback there, and I really appreciated the content. It was a lot to digest, but I think there's enough concrete there for us to take a few things out of it for sure. I really liked your emphasis on leadership and the need for leaders to sort of be in that calm space before they can help others. And I just wondered if you could expand a little bit on some of the resiliency and how you lead, even when you feel moral injury, how you work through that, particularly if it's someone of, potentially a governor that's not following public health advice that you've given them, or a member of a city council.
Yeah, our public health officials are in such a difficult place now, and I think we have to remember that part of why someone might not be hearing you is because they might not be in a place where they can, and so maybe sharing that information at that time, we might need to move back to just regulating and being with people in their fear and in their concern, because until that's addressed, I think the logical stuff doesn't process, right? And I think everybody is in trauma. Everybody is in the midst of complex trauma. So I don't know that everyone's acting in a rational way that they would if we weren't in that space. Our communities are hurting. As people, we're hurting. We're looking for solutions, and we see that in also the social unrest coming at the same time. I don't think it's a coincidence. It's really this notion of such extreme complex trauma that we are going through.
Right.
And yeah, so the more we can stay calm and not take it personally, that's about them, not about you. I think it's going to be really important for our own preservation.
Yeah. And I like that reframe, what's strong about you versus what's wrong with you, to understand the other, I think that's really important insight.
Mm-hmm.
Casey, can you synthesize some of these questions?
Sure. Lisa, thanks so much for talking about some grounding techniques. And would you be able to offer some techniques for someone who is maybe angry about coronavirus and the need to quarantine and isolate? They may think that it's a hoax. How do you talk to those people?
So I think that's where, like I was saying with Mike, I think we need to address the fear. If we go back to, let me see if I can do it on the slides. If we go back to the continuum from Dr. Perry, if these people, if who you're talking to, if you can recognize that they really might be in fear or terror right now, and go back to those active listening skills. Hear what they're saying first. Because we, as humans, we're seeing it kind of in an extreme format right now, but we don't hear someone or listen to them until we felt heard first. And so I think we're all so emotionally driven right now, right? We want people to be safe. We want them to hear us, but we might have to backtrack and start some active listening and really just being in that space with them as we stay calm, even if the fears are irrational, even if we know there are ways that would take care of it. I think until they feel heard, which is really hard. I'm not suggesting this is an easy thing to do. But recognize they're really they're not in their rational brain, right? They're in alarm, fear, or terror. And so helping them just be heard might help move the conversation forward.
Great. And while we're on this slide with the arousal continuum, could you maybe share some tips for self-regulation or things to say to yourself if you're maybe in the alarm, fear, or terror stages? And how do you also convey these messages to other leaders in this space?
Sure. As leaders, I think we need to practice as humans, right? I think even more so on leaders, we need to practice this before we get there. So find out what calms you, right? Is there a mantra that you can say? Is it journaling and writing things down? Is it yoga, going for a walk? If we go back to the other slide, I'll bring it up here, with the 6 R's, right? Doing things that are bilateral stimulation, right? Just reaching across your center is so important. Knitting, get a rocking chair, get a safe space. I can share with you when we started the self-isolation, I actually, in my home, I had 3 children. I had 2 children come back from college, and I had other kids in school that were all of a sudden here all the time. I was working. I lit candles. I played spa music. We took breaks. I went into my children's rooms and rearranged them to give them a safe space in that. It's some of those basic stuff, right? We did have comfort foods. We didn't focus so much on bedtime routine, bedtimes as much as making sure that throughout the day people were getting the breaks that they needed. So I think sometimes we need to look outside of the box, move away from maybe what we've done, and just go back to those basics of feeling safe and regulated. One of my children loves baths and ended up taking a lot of baths during the beginning of this. We turned off the TV. So what makes you feel good? What type of music? We've had dance sessions in the kitchen with blaring songs. None of us know the words, but we think we sound really good. But all those different ways in which we can take care of ourselves. Just allow yourself to be your core you during those times, I think.
Great, thank you. And going back to active listening a little bit more, if you're talking to someone who may not be doing so well, what strategies would you recommend to empathize with that person without coming across as pitying them? Or if you were the person who needed help and wanted to reach out to someone but didn't want to feel like they were pitying you, how do you navigate that kind of balance?
Brene Brown does a real great definition, like the difference between sympathy and empathy, right? Sympathy is that feeling like someone's pitying you, like, oh, wow, it looks like it's really bad kind of over where you are. Empathizing is actually just witnessing someone's pain and just being there with them and connecting with when you might have felt that emotion. We can never know exactly what someone else is feeling. We can never know why something is reaching them in a certain way. But I think a lot of it is actually, there's so much power in silence, and just being with someone and acknowledging their pain. You can't fix it. I think, when we step in to fix it, I don't think that's empathic. I think it's about staying calm, staying present, and going through the steps of that active listening of, I hear what you're saying. This is what I hear you saying. Am I even right? Tell me more about that. What does it feel like to feel like that? What do you think about? Be curious and really lean into the relationship and put your expectations aside.
Great. So some of the people on the line today, they may work with vulnerable populations, such as seniors or aging populations. And while they have cut back on home visits, there are still times that they will need to visit those seniors. But sometimes they're seeing coworkers on social media who may not be taking necessary precautions before entering those seniors' homes. How do you handle this type of situation?
So that goes back to that's one of the cruxes of moral safety, right? Do you have a workplace where you can raise those concerns? And if you don't, as leaders, we need to make it safe. Because if not, we're watching people do things and not feeling like we can speak up. Moral safety isn't about avoiding hard conversations. It's actually being able to have them and come out the other side. So, I think it's so important that we really look at building trauma-informed, resilience-oriented work cultures, because that will create the space to say, hey, I'm not sure you're safe enough to go to this person's home, and there's an accountability there with each other, because there's an agreed upon mutual respect. And when we don't feel like we can say something, then that's a problem.
Great. Could you also speak to the notion that there is no expertise anymore? It seems like no one really seems to see a final authority with the best answers, or they may not be trusting of public health leadership.
I think that speaks to the collective trauma that we are experiencing as a country. I think that there are pockets of people searching for those truths or not understanding, where we are. I think as a country, we are collectively traumatized. And I would say people are really in their lower brain, and that's why it feels like that. And until we can create those safe spaces, until we can emotionally take those breaths as a community, unfortunately, I think we're going to continue to see this unrest. And I think it's a product of extreme complex trauma.
To add to that, I just want to mention that our next Insight and Inspiration series speaker coming up is Tom Nichols, who wrote the book, The Death of Expertise. And he's going to talk about sort of the death of formal expertise and how social media and the internet has changed what people do and believe when it comes to expert knowledge. And I think that's going to be another important follow-on to addressing some of the issues specific to COVID.
Great.
Yeah, and Casey, I recognize we're at time.
Yes. We are at time, but if you have additional questions, Lisa's contact information is here. We'll also be collecting all of the questions from the chat box and the Q&A, and we'll go through those as well. So thank you so much, Lisa, for your presentation, and Mike for joining us and providing your perspective from ASTHO as well. We really appreciate both of your time on this very important and timely topic. And I just want to remind everyone that these slides and recording will be archived on both the National Council and ASTHO's websites. I know we've had a lot of tech issues today, so I really appreciate your patience with us. And our next webinar in this series will be on August 20th on crisis leadership and resiliency. So we really hope that you'll join us for that. Thank you so much, everyone, and have a great rest of your week.